Okay, in this final video on the introduction to metabolism endocrinology, I'm going to look a little bit about discuss a bit about the naturopathic approach to endocrine disorders and how that's similar, maybe even a little different from the conventional approaches, and then talk about how we can think about the therapeutic order in a new way, so that as we go into different endocrine conditions, we can see how to maybe appropriately use it. So what is naturopathic endocrinology? So first of all, I should say it's based on the principles of conventional endocrinology. So we have to understand all the conventional conditions. So these usually encompass the extremes, either deficient or excess of different glands. So going back to the adrenals, Addison's disease is due to destruction of the adrenal gland, usually from autoimmune processes, and we get less cortisol and other adrenal hormones. And that can lead into a fatal adrenal crisis. Versus Cushing's disease or Cushing's syndrome refers to any condition that causes increased cortisol. Cushing's disease is one of them, usually from a pituitary tumor that oversecretes ACTH. But Cushing disease would be the opposite of Addison. So those are sort of conventional endocrine conditions. But in naturopathy, we also look at like the HPA axis dysregulation. You're not Addison's or Cushing's, you have normal 24-hour cortisol, but your rhythm is all screwed up. And you're not sleeping well, you're stressed, your immune system is down, all those kinds of things. That's more of an intermediate area, and we tend to see a lot of that in the clinic. So that's one area where we tend to emphasize a bit. Back to the conventional guidelines, we have to understand what are the current guidelines for treatment of a lot of these conditions. And this is an area that gets very controversial in our profession. You probably have gone to different seminars, everyone talks about thyroid or adrenals and they have their own protocols. And often when it comes to laboratory reference ranges, they're sort of putting out numbers. And the question is, where are you getting these numbers? And that's where we have guideline committees that have actually gone through the literature and have really tried to assess it. Now, that's not to say we have to follow these committees' recommendations, to the T, but I think they give a pretty good starting place for us to sort of begin to, especially with lab reference ranges, to begin to see what's appropriate and what's not. So a couple of guideline committees that we'll be talking a lot about will be the American Association of Clinical Endocrinologists, or the AACE, and the American Thyroid Association. There's American Diabetes Association, and so forth. So these will be important as starting points for example, looking at what is the ideal TSH range. Now, again, many NDs are going to disagree with what these guideline committees have said, but I think it's important we start there, we look at the evidence, and then we start to make decisions based on that, versus, you heard someone at some seminar say this, and that's what their ideal is. We hear a lot of that, and that's something we're trying to change in the profession to make it a little bit more, not so much standardized, but a little bit more so cohesive in terms of what people are doing. So we need to recognize the importance of evidence-based medicine really in guiding diagnosis and therapy. So again, we're going to look at the conventional biomedical endocrine conditions like Addison's, Cushing's, type 2 diabetes, hypothyroidism, and so forth. We need to understand what the pathophysiology is, what the assessment is, what the treatments are for all these different conditions. But then we're going to look a lot at subchronic or functional conditions like the HPA axis dysregulation or HPT axis or HPG axis dysregulation. These are not as discussed in the conventional literature, but they are in the research literature. If you go to PubMed, there's actually a lot of articles on these things now and how important they are for a lot of our chronic health conditions. A lot of the conditions we see in the clinic are related, for instance, to HPA axis dysregulation. And then we're going to look at how supporting glands is more than just giving hormone. It's also understanding how do we give the right nutrition to the gland? How do we look at other hormones? So for example, how do we address insulin resistance, and could that actually help your thyroid work better when you do that? Or address your HPA axis and that makes your thyroid work better. So that's going to be looking a lot more comprehensively at the whole system. So I'm going to talk about that as we go through each condition. And then we, of course, as naturopaths, also use, in addition to hormones and potential medications, we're going to look at diet and exercise, lifestyle, mindfulness practices, micronutrients, herbal medicine, that sort of thing, as opposed to just giving hormone replacement. Now, This really, again, if we start to look at the biomedical or conventional approaches and a more traditional naturopathic or humoral approach, we can say there's really two approaches to medicine. And I talked about them a bit with the discussion of hormesis. One approach is to address pathogenesis. And so this is what we're most familiar with in conventional practice. And that would be to address the pathogenic mechanisms like inflammation, infection, oxidation, toxemia, and so forth. So we're going to use antimicrobials, anti-inflammatories, antipyretics, antihypertensives, etc. So this is the anti approach. And we're going to usually use more pharmacologic, larger doses to have this inhibitory effect on physiology. The other approach is to support salutogenesis. And this is really the approach of more the humoral medicines. And in salutogenesis, we want to really approach and focus on the factors that support health and well-being. These are factors that support homeostasis and allostasis and that reduce the overall allostatic load. This term, salutogenesis, was coined by a medical sociologist, Aaron Antonovsky, in the late 1960s. And he really put it out there as, we need to think more in medicine about not just suppressing the disease process, but also at prevention, but also looking at restoring the balance of your inner terrain, essentially. So this is going right back to the humoral concepts. Usually remedies that support salutogenesis require smaller, what I'm going to call here, hormetic doses. So we're going to be looking at this dosage range. And again, with hormones, that can sometimes be in the 10 to the minus ninth, 10 to the minus 12, so nanograms, picogram ranges, and so forth. Same with herbal remedies, drop doses, fairly low doses of teas and tinctures and things like that usually put us in the right range using diet, nutrition, versus just loading up on supplements, loading up on standardized extracts and these different things. Those have an effect, but more on addressing pathogenesis, not so much a salutogenesis. So the important thing here is not to say one is better than the other. It's to say when is what appropriate. So if you have a case of a patient with rheumatoid arthritis having a flare and it's really damaging their joints to the point where it can create permanent disfigurement and so forth, then we're probably going to need to jump to level 4 and use a suppressive therapy using immunosuppressives. Versus more chronic management, we might think about more of a salutogenic approach and so forth. Person comes in with pneumonia, we're going to think of an antimicrobial that's addressing pathogenesis. But we also might think about using herbal therapies to improve the lung terrain, to improve immune response, so that now the body can get a better handle on that microbe. Good example of that is thyme. We hear about thyme as being an antiviral, antimicrobial, and actually it's not in the human body. We never actually achieve the minimum inhibitory concentration of thymol, which is the main constituent in thyme, to inhibit bacteria by just eating it orally. In fact, if you did that, you'd have to drink essentially what's about a tanker truck full worth of thyme to get that level. So thyme, in the way we use it clinically, is actually not a very good antimicrobial. But what thyme does is it actually increases blood flow to the lung fields. So we actually get more of an immune response and so forth. So we can say thyme and most of our herbal remedies are supporting terrain. And then we might need on top of that something in a larger dose, maybe more of a pharmaceutical application to address the microbe or whatever that is. So keep that in mind because I think a lot of people get those concepts a bit confused. So that brings us finally to the naturopathic therapeutic order. This was a set of guidelines that was first laid out by Jared Zeff and Pamela Snyder in the 1980s. They proposed a 7-step therapeutic order, which essentially says you start with the least invasive and you move upward to the most invasive. So drugs and surgery, most invasive at the top, things like diet, lifestyle, more at the bottom. And so that's kind of the general idea. So as a naturopath, it's not about either or. It's not about natural things versus drugs, etc. It's about when is it appropriate to use what. And again, that largely depends on dosages. The larger dosages, even of herbal therapies, can have a suppressive effect, which we might need in some cases. Smaller doses have more the salutogenic effect. So based on this idea, I've kind of simplified it because that's a little complicated with the 7 steps. I've simplified it for this course, and this is what I use clinically, is a 4-step therapeutic order. So a lot of discussion about this, and I'm just going to throw it out there as a starting place maybe for further discussion. So let me go through the 4-step therapeutic order. So level 1 would be essentially supporting conditions for health, and that would be diet, getting the right macro and micronutrients, exercise, lifestyle, which includes sleep, tobacco use, alcohol use, other drug use, etc., healthy lifestyle habits, and then stress reduction. So techniques like meditation, journaling, art therapy, counseling, whatever might be necessary for improved stress management. So that would be all level 1 therapies, conditions for health. That's sort of a baseline. I don't think anyone's going to argue that those are helpful for people, and if we can motivate our patients to engage in that, that always has a healing effect. Level 2 therapies would directly address salutogenesis. So this is going to be therapies that really support the neuroendocrine system and your organ systems. And this would be using herbal therapy, micronutrient therapy, glandular therapy, like glandulars and protomorphogens. If you don't know what a protomorphogen is, so a glandular therapy is when they take an animal gland, usually a cow or pig gland, like an adrenal gland, they actually defat it. So they take the steroids out. So there should be no steroid hormones in there. But what's left are all the micronutrients, vitamins, minerals, some peptides, which are needed for that gland function. And then they freeze dry it, and they sometimes mix it with other things. That's a glandular therapy. A protomorphogen is when you take that slurry and you actually put it in a centrifuge and you spin it down and you separate off the DNA and the RNA, and you freeze dry that and give it as an oral supplement. Now, theoretically, that shouldn't work because you eat DNA, RNA, it just digests. But interestingly, there are some effects, and this is, I think, one of those really unexplored areas. So that's called a protomorphogen, or sometimes abbreviated PMG remedy. And we think of those as sort of turning on the enzyme activity within the gland so it can more effectively make different hormones. That's something that needs a lot more research, probably won't be happening because, again, from a conventional pharmacologic way of thinking, it shouldn't make any sense. I just say anecdotally, I have several patients who swear by protomorphogens. They really have a hard time even stopping them. Their fatigue and everything comes back. So something in there must be happening. But importantly, in glandulars and protomorphogens, there should be no hormones actually in those products. That's going to be different than like natural desiccated thyroid, like Armour thyroid, where you actually take pig thyroid and you keep the thyroid hormones in there, T4 and T3. So that's different than a glandular or protomorphogen. Homeopathy, again, below Avogadro's number, would support physiologic terrain. Acumoxotherapy, so a lot of people just call it acupuncture therapy. It should technically be acumoxotherapy. That's acupuncture with the moxibustion, which is the heating. Physical medicine, light, sound, pulsed electromagnetic fields, etc. So all of these would support salutogenesis level 2. We can go a little deeper, and I won't be talking as much about this, but we can also argue you could support psychological terrain. And that would be using homeopathics above Avogadro's number, which again, we're getting into sort of an undocumented area, more based on anecdote and history than on scientific evidence, although there is, interestingly, evidence of effects of dilutions above Avogadro's number. That's interesting to look at that literature for that. Flower essences, which really would be above Avogadro's number, this you can't really measure. Chemical constituents within the flower essences, cognitive behavioral therapy, counseling, etc. It all supports psychological terrain. And then we might say we can go even further and support mental spiritual terrain with mindfulness meditation, art, music, movement therapy, biography work, etc. Again, for this course, I'm not going to really focus on these, but we should take them into consideration. And in your practices, you'll find your own ways, I think, to work with that. Level 3 would be direct replacement therapy, and that's going to be specifically hormone replacement. So I'm going to talk about the different hormone replacement strategies for different things like thyroid, adrenal, and sex hormones as we go. So we'll be looking at that. I would also put nutrient replacement in here, and that'd be using more specific vitamins, minerals, again, I tend to, if we're going to think salutogenically, we want to use those at lower physiologic dosage ranges, although a lot of people go way above that. So we can say that this is sort of straddling either between salutogenesis or level 4, which is directly addressing pathogenesis. And this is where we have to make decisions of, do we need to refer these patients to endocrinology or another specialist? And this would be using more high-dose herbs, nutrients, using specific medications, surgery, radiotherapy, and so forth. So that would be our level 4 interventions. Again, the final point being, we need to understand with a given patient where we need to start. So if you have a true Addison's patient, we got to start here. They can go into a fatal adrenal crash unless we replace their hormones. You can't really use herbal therapy and whatnot in those cases. Versus someone with HPA axis dysregulation, here we start here. We don't usually go to level 3. We don't want to give them hormones in those cases. And someone with Graves' disease, hyperthyroidism, we might need to go right to level 4 to suppress their thyroid before they develop very serious consequences of an uncontrolled thyroid. So this is where we're going to be looking at. And so for every condition, I'm going to try to go through these 4 levels so you get an understanding of where we need to start. Okay, so that wraps it up for the introduction to endocrinology. In the next videos, again, that'll go through the pineal gland.